That's a really good question. You know, the HDAC inhibitors are really a new brand of medicines that have been hitting the cardiovascular arena over the last 5 to 6 years. And they work by altering gene expression, which is really a property that is unique to this set of molecules. And the properties that they work on are the ones that we are most interested in pulmonary hypertension, which is their ability to remodel the blood vessels themselves in the lungs, to reduce the hypertrophy of the media of the vessels, to reduce the fibrosis in the adventitia of the vessels, and to make the endothelium respond more normally to cytokines and growth factors that they're supposed to. Yeah, so CS1 is an HDAC inhibitor, which enables it to do many of the things that we just mentioned, including remodeling of the blood vessels in the lungs, which causes a reduction in the pulmonary pressures that the right heart is exposed to. Because it is antifibrotic, it makes the blood vessels more compliant, again, reducing the pressure and allowing the right ventricle to recover. It is an anti-thrombosis drug in that it inactivates PI1, which is a molecule that is known to cause microthrombosis in the small pulmonary vessels. And by cleaning those up, you clean up not only the vessel, but the clot is often an elaborator of other growth factors and cytokines. So you eliminate not only the small obstruction of the microthrombus, but the cytokines and growth factors that are elaborated by that thrombus that can perpetuate the remodeling on the blood vessels that we don't want. So this is a molecule that could be used up front in patients with this disease to remodel, particularly if they didn't have very severe disease in which imminent death was supposed. And so people with early disease who may not need all the other medications, that we just need to restructure the arteries. So I think it would be very helpful in those early patients. In addition, I think it's going to be extremely helpful in patients who are stalled on current vasodilator therapy which is intended to dilate the vessel as much as you can. And we've seen limitations in that approach. So drugs that could be added on top of that further remodel the vessels on top of what these other medications did, could allow the vessel to restore to normal and again, improve the way the right heart functions, and may also allow for the or weaning of these other drugs if the vessel becomes more structurally normal.